I chose to choose this topic for today because, there has been talk, lots of talk about autism, what about it, what are its causes, etc. Some of them have been based on opinion, not founded on reality. So I thought that's what I would address today. Most of you who are here are probably already know someone or something or a lot about autism. Can you tell me who among you, first of all, have a family member or who are himself or herself a person with autism? Okay, certainly the majority, right? Okay, so a lot of the things I will say will probably be familiar to you already. So let's move on. Okay, these are the topics that I would like us to cover today. What is autism? Is it a recent phenomenon? Is it an epidemic? And what causes autism and what are interventions? Note, I want to say interventions, not treatments, because there has been controversy about that. Do you treat or do you help? Is your intervention a help? Yes, please. Okay, let's start with what is autism. It is something complex. It is multi-dimensional human condition. Very prominent is the social condition, the social dimension. Issues related to communication, reciprocity, exchanging of relationships and contacts. Eye contact. It's said that people with autism have a hard time looking directly at someone. Body language, there are issues about interpretations of other people's body languages, gestures, facial expression. You cannot always tell what autistic person's feelings are, and vice versa. It is said that autistic persons are not very good about understanding other people's emotions. Mood dysregulation, lack of stability, and difficulty maintaining relationships. Autism, the word auto implicates auto, self, difficulty in reaching out, having relations with other people. That's the social dimension. There's also the behavioral dimension, characterized by persistence, wanting to do the same thing, and repetitiveness, doing the same things over and over, and having an inability to change, to get out of that pattern. Fixation of interests. Usually, there's a hyper-focus on one thing, and like my son loves cars. So you speak to him, all that he'll talk to you about will be cars, okay? He's very good at cars, but he's fixated at that. Perseveration means having to continue what they're doing over and over again, having a hard time stopping. Whatever they're doing, it's hard to stop. For instance, transition, any kind of transition, whether it's a course or a life change, moving from house to house, apartment to apartment, changing your teacher, changing your school. Sometimes that's, very often, not sometimes, that is a problem. Hypo or hyperactivity. Well, hypo means, really not being able to be alive or appearing not to be alive, being very passive, and the opposite, too much, just being restless, moving about all the time. Okay? And more about the nature of autism. It's neurological. It's in the brain. It's brain-based. It's brain-based, but it's experienced in behaviors, and it's observable in behaviors. As of now, we cannot, even scientists, medical people can still not detect autism beyond behaviors. There's no brain test, there's no blood test. So far, what we rely on is observing behaviors. It's usually manifested early. And right now, actually, in terms of screening, the advice is to screen as early as infancy. Okay? It can be detected in many cases as early as infancy, but sometimes not. And that has to do with another issue, in that sometimes it's not detected later on, even in adulthood. So many people, for instance, realize that they themselves are autistic, or their family members understand that they are autistic only later on in life. But it is lifelong. You might hear things like cure autism, okay, meaning, okay, it's there for a while, but then it goes away. But that evidence that it goes away is really not there yet. What it appears to be is that it is lifelong. So even if there's an improvement in behaviors, certain issues, usually the core symptoms of autism, remain. Those people will be able to function very well in society, but certain core issues remain. Have you heard of Dr. Temple Grandin? I'm sure, okay? She would be the most famous person with autistic these days. There's another one, but I'll talk about her later. She herself said that although she had become an adult and lost a lot of the autistic traits, she still felt as an adult the basic core symptoms of autism. It was still there, despite her ability to write a book, gives talks, speeches. She felt her core autistic features were still there. The other nature of autism is that very often it's accompanied by something else, like epilepsy, gastrointestinal disorders, intellectual disability. You know, we used to call it something else before, right? The R word. We don't use that anymore. It's intellectual disability, accompanied by, in some, not in everyone, ADHD, attention deficit hyperactivity disorder. They often happen at the same time, but it's not the same thing. So if you ever hear that ADHD is autism, that's not correct. ADHD is different from autism. And there's depression, anxiety very often happens with autism, but a lot of that comes probably because life for an autistic person is not always easy. You know, there's frustration, and this then can be accompanied by depression and anxiety, even if they really are separate conditions. It could be there. A person could be autistic and be a depressive person, entirely independent. Okay, that's possible too. But not everyone who has autism will be depressed. Not everyone who has autism will have epilepsy, intellectual disability, GI disorders, etc. Epidemiology. Epidemiology is that science which tries to describe the prevalence of a condition across the population. The prevalence of autism worldwide has been seen to be 1 to 2%. Okay, so that's a small number. But if you think in terms of billions of people, millions of people on Earth, 1 and 2% is a large number. Okay, the population of the Philippines now is what, 200,000? Or is it, no, 200, is it 2 million or 200,000? 2 million, it's million, not thousand, right? It's 2 million. So you can imagine, 1% of 2 million is a very big number of people. I'm sorry, 102 billion. So 1% of that is still a very large number, okay? And 2%, just double it. Other countries report a much bigger rate. For instance, Korea I don't know why, but they have reported a prevalence rate of like 7-8%. Okay? The male to female ratio. You will notice more males than females with autism. It used to be that the statistics said 4-to-1 ratio, but the more recent statistics are suggesting that it's really closer to 3-to-1, maybe even smaller than that. Why? One possible explanation is what's called camouflage. Women with autism are better able to hide, to cover up for the autistic traits. They're not as restless, they are a little bit more sociable, but able to hide it. May I point out to Bing Bing? Okay, Bing Bing, can you say something short, okay? Were you able to camouflage? When did you detect, when was your autism detected?
I just had my formal diagnosis last August, but I've been suspecting it for years because of work, because in work, I always find very good work because I find me talented and functional, but then when they get exposed to my quirks, as they call it, I find myself not picking up social codes and cues, and I get in trouble with office politics. So the masking, because I camouflage my mask, the anxiety increases making it weirder and weirder. So that is the reason also I sought formal diagnosis because it's so weird to keep you on and I've had so many work already before there's compassion. So there is, I call myself underperforming and overqualified.
Okay. Thank you, Bing Bing. So that's one reason that the male-female ratio seems to be higher, male to female, but as more women come out, then that ratio goes smaller. There's also another theory which is being looked at, that there may be something biologically protective in women, like hormones or something on the chemical end may be protective of autism in women. That's not clear yet, but that has been looked at and is being studied. Okay, the important thing about epidemiology is that the prevalence has been increasing over time. Yes, please? One of our questions was, is it an epidemic? When you talk about epidemic, you're usually talking about something that happens all of a sudden for a period of time. Autism is not an epidemic. It's not a new phenomenon. It was actually encountered as early as 1908 by a Swiss psychiatrist who called it autistic psychopathy, kind of a mental condition that was autistic into oneself. It was not until 1943 that the first person who was diagnosed as autistic. That was by Leo Kanner. He had he had seen about 12 people. He saw many people, but he saw this set of features in a certain number, and he started to think there is such a thing, a condition such as autism. And he was the first to diagnose, I hate to use the word diagnose, to label his patient as an autistic person. So 1943, but since the 1980s, there's a reason for that, and another slide will show it. The awareness of autism has grown. And because of this, I think part of that, the awareness, has also contributed to the higher prevalence. Not necessarily that the real prevalence is increasing, but the awareness that it exists is increasing. And that has been followed by an explosion, really an explosion of scientific research. This is Douglas Triplett, the first person given the label of diagnosis. This is him as a young man. He's 82 years old in this picture. This picture was in a book by Silverman, published about 4 years ago. So Douglas Triplett must be about, 86 years old now. I think this is very important to consider because it tells us that autism can continue for a long time to old age. That's one. Secondly, that people with autism can live to a long time. You know, not 60 or 50 or 70, but they can be as old as 80. Okay? Okay, I spoke about the history of the diagnosis. I mentioned that 1908, okay, it was mentioned already. 1943, early infantile autism by Leo Kanner. DSM, that's the Diagnostic Statistical Manual for Mental Disorders by the American Psychiatric Association. There was a DSM-1, there was a DSM-2, 1952 and 1968. But autism was not mentioned there. They saw it as a childhood form of schizophrenia. It was not until 1980 with DSM-3 that was the first mention in the DSM of autism. It was called infantile autism. In 1987, DSM-4, the term was changed. It became pervasive developmental disorder, and it included 5 conditions. Autistic disorder, Asperger's, which many of you are familiar with, Rett's disorder, childhood disintegrative disorder, PDD, pervasive development disorder, not otherwise specified. In 2013, there was a big change. It became called autism spectrum disorder. The word spectrum gives the meaning. Spectrum because it's not one thing, it's a range. The condition of autism is a range of many different kinds of behaviors, conditions, and each one of them occurs at a certain level of, you might call severity, from hardly, mild, moderate, severe, and profound. So it's a spectrum. So, which makes it not easy to diagnose autism, because particularly with the higher function ones, it might be very difficult. With the lower function ones, it might be called intellectual disability, okay? But the point is, by 2013, there was the acceptance that we're talking about a range of severity and of the disorder. Also, Asperger's is no longer a diagnosis. Although we still use the term, it's really not a diagnosis. It's the far end of the autism spectrum. PDD and Rett syndromes is totally out. It's a syndrome by itself, okay? You can pass that. Here is a demonstration of the rising prevalence. From 1997 to now, see how increasingly it's really gone up. Okay? Why the increase in prevalence? We touched on this a little bit. We said what an epidemic is. And one of the reasons that it's grown in prevalence is that there's been improved articulation in medical and psychiatric nomenclature of the signs, resulting in increased recognition of autism by the family, by schools, by clinicians, pediatricians, psychiatrists, and importantly, by the autistic persons themselves, recognizing that that's what they have, or they are. One interesting kind of note is that very often adults realize that they are autistic because having brought their autistic child for diagnosis and answering the questions, they come to realize, ako rin pala, me too, I am an autistic person. Okay, with the increased prevalence has been increased attention in many areas, and I like to bring up the fact that it's been talked about in entertainment. I'm sure you all know of Rain Man, right? And even at the time that was so long ago, years ago, right? The director already recognized that he was describing an autistic person. This next one is What's Eating Gilbert Grape? This is Leonardo DiCaprio, right? He was a young man, but it was also very clear that they were talking about a child with autism. And then, of course, we have Forrest Gump. But although he had all the autistic signs, it was not really spoken that he has autism. But it was recognized that he had many of the autistic signs. And finally, do you know who this guy is? Okay, Sheldon Cooper, right? Even in that show, they don't strictly refer to him as autistic, but he's always displaying autistic signs. Okay. Well, that was entertainment. That was not real. This one is real, right? This is Dr. Temple Grandin. She brought it to the fore, and by talking about it, by writing books about it, she made the public really aware of autism and how okay autism can be. Even more recently, Greta Thunberg tells everyone, right, I am autistic. And she's quite something. I hear she's been nominated for the Nobel Prize. We'll see. Oh, you've heard that too. Okay. Okay, let's go down to start talking about science. Causes of autism, what are they? I prefer to talk about risk factors because it's really difficult to point something down as a cause. When we talk about cause, risk factor, or anything for a condition, we usually look at nature versus nurture, or biology versus environment. Okay? There's been a lot of research on this topic. And to summarize, what has been almost agreed upon because of the countless well-done studies on the topic, what seems to be risk factors for autism are primarily genes and environment. And most of it comes from genes. A smaller proportion comes from environment. Next slide, please. Okay, what do we know related to this? The scientific consensus is that autism begins before birth. The implication is that environment has less of a role, right? Because it begins before birth. Not entirely though, but genes play a big factor. Oh, here it is. Genes, 60 to 90% contribute to autism. Environment, 20 to 40%. The environment usually has to do with the prenatal environment. What happens before birth? But the fetus is already there, experiencing the environment of the mother's womb. That's environment. Epigenetics. Epigenetics is when the genes are modified by environmental influences. The environment does not change the genetic code, but it influences it, okay? That's epigenetics. And that's what we would call postnatal environment, after the birth. Okay. Okay, we'll go over here more specifically, but First considered were environmental factors. I'll go very quickly because we'll go over this more slowly. Social psychological context, the cold parent, specifically the refrigerator mother. Have you heard this before? Has anybody heard this before? Autism was caused by a cold mother, not really warm and taking care of the child. It was mentioned by Kanner. We'll go over that more. Prenatal conditions has to do with the mother's health. I mentioned this. Perinatal complications, related to delivery. Postnatal, I mentioned that. After birth, heavy metals, deficiency in folic acid, omega-3, vitamin D, and of course, we'll talk more about that, measles, mumps, rubella vaccine. Please. Okay, the cold parent. It was even suggested by Leo Kanner, 1943, but it was popularized by Bruno Bettelheim, a psychologist. He wrote books about it. He wrote books about the cold mother as the cause of autism. Well, one reason for Kanner and Bettelheim saying that is that at that time, they were seeing a very limited group of kids with autism and, of course, mothers with autism, a kind of very highly selected group, tended to be highly educated, more, and I believe Bruno Bettelheim's clientele had teachers, professors, doctors, etc. So maybe they were not as warm and free as other mothers. But the cold parent, refrigerator mother theory has been debunked. Forget about it. Or talk about it, but it's not a risk factor. More environmental factors. We talked about prenatal conditions, birth complications, postnatal exposures. I'll go very quickly. The evidence there's some evidence, but weak, moderate. All right? It could be one of the epigenetic factors, but it's not so strong, certainly not as strong as genes. Okay. Finally, this is a big deal. The measles, mumps, rubella vaccine. You've heard about it. Tell me something. I'm sorry, what's your name? Hi, okay. Hello, Harriet. 11. So the risk of an adverse effect from the vaccine, the benefit outweighs. Okay. Okay. Yeah. Yeah. Every now and then. Right. The thing about it is that they usually occur at about the same time. So you attribute the vaccine and the unfolding of the symptoms. Okay. It has debunked, but support continues. But particularly here, I'd like to show you the scientific evidence.
How about that
What's that?
the component of the vaccine?
We'll talk about that. Thimerosal and mercury.
Yes.
Okay?
Actually, when my son was diagnosed with autism, kinumpir ko.
Kaya, before I do believe, nagkaroon din ako ng conviction na siguro nga yung vaccine. Kasi my daughter was born in 1995 and then yung son ko 1998. So, nung kinumpare ko lahat ng vaccines nila, magkaiba. Yung kung kailan, talagang tinisisa ko kasi talagang praning na ako, di ba? Kung paano mo kung saan ang galing. So yun yung mga nakikita kong baka nga. Kaya naniniwala din ako that time. Although maraming nababasa, pero in my own studies.
Okay, I will show you why not. Next slide, please. Okay, this whole scare, it's a scare, right? And it's very natural. When you're a parent with autism, you're scared. And where did this come from? What did I do? Did I do something wrong? You know, it's easier to blame somebody else or something else, right? So here we are. There's Andrew Wakefield in England, publishes something in Lancet, a very prestigious journal, in 1998, that he had seen among his sample of 12 kids with autism, that he thought the vaccine caused their autism. Such a problem. First of all, 12. That's a very small sample, right? And then the kids already had autism before they got the vaccine. Okay, so in terms of research validity, you usually will want to compare one group versus the other. Like one group that you give something to, one group that you do not give something to, and look at the outcome. He didn't have that. He just had one group. That's not valid scientifically. Plus, it was discovered later on that he actually falsified data. He put wrong data in, you know? And after that, it was discovered that he had been supported by a pharmaceutical company that was trying to replace vaccines for that purpose. So what happened after all that was discovered, including reviewing the fact that his research methods were unacceptable, his co-authors took away their name from the article, and Lancet retracted the findings. Unfortunately, it took 12 years before this happened. So all that time, people were believing him, particularly in England, where he first published. He was on TV, etc. Of course, parents reacted to it. They stopped vaccinating their kids. Guess what happened? The incidence of measles, mumps, and rubella went up. That happened in the States too, only recently. In New York State, for example, in other states too, the incidence of measles went up in the last 2 or 3 years. So the governor said, no more, you cannot accept a child in school unless they're vaccinated. So what happened? The incidence of measles went down. Okay, so further on. Okay, some scientific evidence. In 1998, the same year that the Wakefield article came out, there was actually another study. It was a 14 longitudinal. That means you follow them for 14 years. That looked at the effect of the MMR vaccine on autism. They didn't find an effect. Okay, no effect of a longitudinal study. And then several research studies were begun because of the Wakefield finding. They used large samples, longitudinal data over several years. They used comparison groups, everything that Wakefield did not do. What did they find? No effect of the vaccine on autism incidence. Plus, what you're asking, what about thimerosal and mercury? They've also found no effect of that. Anyway, what was done was they took away thimerosal, so you know that. They took away thimerosal and mercury from the vaccines. Did the incidence of autism go down? No, it continued to go up, despite the fact that that suspected compound, those suspected compounds were taken away. Okay? And then because I said I was going to present to you science, I like to present really good studies. And this is a meta-analysis. A meta-analysis, what it does is it looks at several studies, combines the sample of those several studies, and looks at their effect. Now this one did 5 cohort studies. A cohort study is you look at one group at one time, same group, and you follow them up over a period of time. That's the cohort study. So he looked at 5 cohort studies, more than 1 million kids. They were kids with autism and without autism that he followed. The other group of studies were case-controlled studies. These ones are not long-term. You look at them only once, but one group has autism, the other group does not have autism, and you compare what's going on with them. So even that, there were more than 9,000. So total sample was 1,266. The cohort data revealed no relationship between vaccine and autism, or ASD, nor between autism and or thimerosal or mercury. This is really hard data from lots, from more than 1 million kids, and using really rigorous research methods. The same finding was observed in the case control data comparing kids who are vaccinated or not vaccinated. Okay, that's meta-analysis in 2014. Now I present this to you because I saw something that was published 2019, yesterday, or almost yesterday. And interestingly, this was done not in the US only. In fact, the ones I showed you before was done in many countries. But this one was in Denmark, and it's nationwide. The nice thing about studies in the European countries, they get everyone. They have because everyone is registered. So they study everyone, complete population data. 657,461 children born from 1999 through 2010, followed up from the time they were 1 year of age. Conclusion, strong support that the vaccine does not increase the risk for autism, and if you have susceptible children, what's a susceptible child? A sibling, okay, of someone with autism, that's susceptible. There was no increase of that either in relation to the vaccine. Yes, please. Oh, pass this one. Thank you. Okay, let's talk about genetic factors. When you talk about genetic factors, you can talk about inherited genes, or genes can also be not inherited, but mutate, change randomly. Next one, I think, okay. Inherited genes, when you study genes, your best sample are twin studies. There are 2 types of twins, as you know, monozygotic or identical twins, or dizygotic or fraternal twins. The identicals come from the same egg, I guess, and they share the same DNA. And they look alike very much, hardly tell them apart. Dizygotic come from different cells. They don't necessarily look alike. Remember that movie with Arnold Schwarzenegger and somebody else, very short? They were supposed to be twins, so they were fraternal twins. Well, anyway, in the twin studies, they found 60% concordance of autism, meaning that if one sibling had autism, the twin, the identical twin, 60% chance of that person also having autism. But it was not the case for fraternal twins, so that means there was much lower concordance, suggesting that the effect of genes is very strong. I'm told that I have less time, so I'm going to go quickly. Random gene mutation, it's not necessarily inherited. It can happen randomly. Nature has things like that. But I want to say that only recently I saw a study that suggested that even with random gene mutation, there has to be something out there. Maybe grandparents, that it may be coming from. Maybe not directly from the parent, even grandparent, but something there is causing some vulnerability. Next, okay. One thing about genes is that no specific gene or even combination of genes has been identified. The science still does not know. It can be many combinations, many variations, which is why you see so many demonstrations of types of autism. Different genes contribute. And interestingly, among the genes identified as candidate genes for autism, about 20% of them were seen to be susceptible to environmental factors. That's where the issue of epigenetics comes in. Okay. This is it, epigenetics. The environment influences the genetic code, not the underlying structure though. It begins in the fetal stage, and the epigenetic part of it can happen after birth. The influence of the environment. Any questions so far? Are you following what I'm talking about? Wonderful, thank you. Yes? There have been attempts at that, yes. There's a lot of reasons. In fact, the first suspected factors were environment, okay, as I mentioned before. So there have been attempts to try to identify what environmental factors can contribute. Well, what has been seen is the maternal health of the mother. Diabetes, obesity, cesarean, eclampsia. So you try to avoid that, okay? Another one, I think I have a slide on that, advanced parental age. I don't like that, but there have been studies that suggest that older mothers, particularly older fathers, can contribute more to the environmental effect. Okay, right. There has been research on that. What about after birth? Nothing has been identified. That's it. They've looked at pollution, air pollution, medications, that has not been, it's being looked at, but no strong evidence. Okay, now behavioral treatments. There has been an explosion of behavioral treatments. When you talk about what can we do after birth, that would be the area, right? Behavioral treatments. There has been an explosion of behavioral treatments. Most of these have focused on autism. And the most efficacious that's been seen was the one begun by Lovaas. Have you heard this? You probably heard that. Lovaas technique. And he is kind of like the inspirer, but not necessarily the one who did it. ABA. You've heard about ABA, right? Adaptive Behavior Analysis. So that behavioral treatment has been seen to have some effect in moderating, not removing entirely, but moderating the negative traits related to autism. But what has been known about behavioral treatments, yes please, is that early intervention is very important, which is why early diagnosis is very important. So you start the treatment right away. Another feature of behavioral treatments is that the parent has to be involved in the behavioral intervention, not just throw the therapist at the kid. No, have the parent involved in the intervention. That makes these interventions most effective. Okay. Pharmacology, lots of tests have been done, lots of clinical trials have been done, but no medication has been shown to treat the core symptoms, the social and behavioral symptoms of autism. However, there have been two. I'm sure, I think many of you are familiar with it, or some of you. Risperdal. It does affect, restlessness, irritability, and aripiprazole, Abilify, has been shown also to have some effect on the symptoms. Some other medications are considered to look at the anxiety, the depression, the restlessness, but none of them have passed through good clinical trials. So like the Federal Drug Administration of the US has not approved them, but sometimes they're given off-label, But the bottom line is there has been no pharmacological treatment to treat the core symptoms of autism. Are they trying? Yes. And I think once they understand, science understands the genes behind autism, maybe progress will be made. I'll go quickly. There are 2 points of view about autism. Is it a disease, or is it just a variant of the human condition? Pathology or neurodiversity? If it is a diseased state, is it something to be treated or cured? Research on treatments exists, minimal positive findings. Is it a different way of being human, reflecting a naturally occurring variation in the brain? And for me, for us at AAAP, we think about a societal response that can be acronymed into 4 A's: be aware, accept, adapt, and accommodate. We'll talk more about that later. Here it is: awareness, acceptance. You know what acceptance is. Accept the differences, whether they're desirable or not desirable. Adaptation involves not modifying the autistic person, making the autistic person fit the environment. It's the other way around. Have the environment fit the features, the characteristics of the person with autism. Bing, you were telling me something about that also? About the curb effect. Can you go quickly over that?
You're familiar with the curb cut, the PWD accommodation?
This is an example of adaptation.
Curb cut effect, they call it. You see the curb cut on streets where you can easily pull the wheelchair because it's going to hurt the person who has a disability if you don't have that curb cut. What they notice is it's really made for people on wheelchair. But then when it was already instituted all over, legislated, and everybody had that, even senior citizens were able to use that. Those with babies with trolleys were able to use that. Kids with doing the skateboards, having fun because they can pass through it. So this is what they call the curb cut effect. So when you accommodate people with disabilities, the whole community benefits.
Thank you. That's not necessarily autism, but it's an example of the environment being modified to fit the particular need of a person. A good example, a real-life example of adaptation occurred recently, and I put it on Facebook on our page. There was this autistic person graduating from high school, and he was known to be very sensitive to loud noise. So when it was his time to get his diploma, the audience was told, keep quiet, no sound, So that's adaptation, changing the environment to fit the need. Accommodate simply means provide individualized approaches. It's kind of like adaptation, but make the work environment and the residential environment adapted to the needs of not only needs, but the strengths of the person with autism. Just very briefly, these are some persons who are suspected to have autism. Really high-achieving persons. Of course, they were not diagnosed with autism, but looking at their histories, they're suspected to have autism. Okay? Okay, what is autism? Not an illness, a different way of being human. Okay? And I mentioned accommodation. I want to mention what AAP is doing, our vision. In various settings in the US, Europe, Canada, Australia, other communities for adults with autism have been set up. This is the vision of AAP. We want to develop a community where people with autism, adults with autism, can live and grow safely with their peers. It's a massive undertaking. It needs committed, intensive attention and resources. We need society's help. Can't do it by a small group, by parents only. Government, private, and existing organizations for autistic, that will help autistic individuals. We have been planning this. Our architectural leaders of AAAP, the Cham family, have developed design, landscape design, as well as interior design, which I won't show. In Alfonso Cavite, we have a site there. We haven't started because we don't have enough funds, but we have a vision. One of the examples of where they can live. Okay. And how to help make a special place a reality? Be a member of AAP and help us raise funds to construct. Last slide. Donate any amount, anytime, any amount to the Association for Adults with Autism. That's our bank account. And you can also go online. We have a donate thing there if you would like to donate. So that's all. Thank you so much for being here. Okay.